The Spot Her campaign is Eisai's initiative in collaboration with Force, Share, and Black Health Matters to help raise awareness about endometrial cancer, the most common type of uterine cancer. We want to empower people across generations and cultures to spot the signs of endometrial cancer early. Why is this important? Uterine cancer is one of the few cancers where both diagnosis and the death rates are on the rise. And endometrial cancer accounts for 90% of all uterine cancers, and it particularly impacts communities of color where health disparities exist. So you can visit spotherforec.com to learn more about endometrial cancer, to read about real-life stories from those affected by it, and also find educational resources. You can also connect with our patient advocacy partners, Share, Force, and Black Health Matters to find support for people impacted by this disease. And also, we're excited to, for our next phase of this campaign. It's called Meet Me at the Spot, launching later this year. It'll be a grassroots effort, including an educational van that will travel to areas in the country where with a higher incidence rate of endometrial cancer. So it's important that people are aware of the risk factors that may increase developing endometrial cancer. Some of these may include obesity, age, family history with uterine cancer, a high-fat diet, lack of exercise, and a history of irregular periods. Those with other conditions, such as polycystic ovarian syndrome or a hereditary cancer syndrome, such as Lynch syndrome, are also at increased risk of endometrial cancer. It is important to have open conversations with your doctor or gynecologist if you are experiencing any symptoms of concern. This can make a difference when it comes to spotting endometrial cancer early. So some tests or procedures that your doctor may do to diagnose endometrial cancer may include an endometrial biopsy, a DNC, or a transvaginal ultrasound exam. Symptoms of endometrial cancer could be easily overlooked or mistaken for other conditions. And there's also a stigma associated with talking about below the belt health issues. So talking about these symptoms with your regular doctor or gynecologist can potentially spot the cancer early when it's most treatable. So we know that health disparities negatively affect minority communities, and endometrial cancer is no exception. The overall 5-year survival rate for uterine cancers, including endometrial cancer, is 63% in Black women compared to 84% in white women. Black women are less likely to be accurately diagnosed with early stage disease and are nearly 2 times more likely to die of endometrial cancer compared to white women. That is why learning to spot the potential signs of endometrial cancer early is especially important for women of color. You can visit spotherforec.com to learn more about our campaign and also find information about endometrial cancer, read about real-life patient stories that have been affected by the disease, and also find educational resources. You can also check out our partner advocacy groups, Share, Force, and Black Health Matters to find support for people impacted by this disease.